that you'd be here. As I went through the security check this morning at the Indianapolis airport, I thought about this talk. You stop and think about it. We go through security checks because of a handful of people, a handful of terrorists that have changed our world. And it's not that dissimilar from the industry-physician relationships, where a handful of people have changed our world. We've been interacting with industry for many, many years without problems until Wall Street Journal headlines, New York Times headlines have changed our world, much as terrorists have changed how we get on airplanes. I also had to stop and think, why me? When you get old, I guess people think you don't have data, so they give you a talk like this. But then I remembered a wise bit of advice I received from a mentor many years ago, this was over 40 years ago, when I was preparing one of my first talks, so hard, so many hours putting it together, and he said, a month after you give the talk, half the people who remember what you said, the other half will remember you were there. So, with that as an introduction, let me go ahead with my first slide. First I need to know how to work this thing. There we go. One of the fundamentals in dealing with industry is disclosure. So I thought my first slide should lead by example. And I painstakingly went through my interactions. I've been a consultant for Medtronic for 35 years, beginning in 1975 and ending last December. I'll come back to why that happened in a moment. Recently, I gave some lectures at the HRS meeting. I have 4 textbooks that are published by Elsevier: the Bellwell's Heart Disease, Cardiac Electrophysiology from Cell to Bedside, Clinical Arrhythmology and Electrophysiology, and a book that we just wrote and finished that will be out in March on electrocardiography of arrhythmias. I received a salary from Heart Rhythm Society as editor of Heart Rhythm. I write a health column for the Saturday Evening Post, for which I get paid. I write a column for a new mentor on atrial fibrillation, for which I get paid. I've been an expert witness for both plaintiff and defense, for which I get paid. I published a novel called The Black Widows. My first royalty check was $9.50. They've incremented a bit since then. Which reminds me of the lovely quotes by Sherlock Holmes. I don't know how many of you are aware, but Arthur Conan Doyle, the author of Sherlock Holmes, was himself a physician. And there are a number of very famous physicians who were novelists. And yet, despite my relationship with Medtronic for 35 years, I've been past president of a number of organizations, which I use as an indication that one can have a relationship with industry and still garner the respect of your colleagues and not be threatened by conflicts of interest and so on. So what constitutes a conflict of interest? And this has been fascinating to me with a recent example. As editor of Heart Rhythm, I have to approve all the advertisement in the journal. So anything that's published in Heart Rhythm, an ad, I've approved. Now, those include ads from device manufacturers, when I had a conflict of interest, particularly when I was still consulting for Medtronic, no one seemed to thought so, or to do so, but I raised the issue about ads from non-medical industry, watches, cruises, cars, jewelry, etc. And that's anathema. How could you have an ad for Rolex in Part Ribbon? I would have a conflict of interest with Rolex, and I think it would be less than with Medtronic, but nevertheless, that's not how people will see it. But interestingly, at the last American Heart Association meeting, I think we had just raised this at the publication board meeting, I went out on the floor, and at the AHA, there were booths for cruises, for jewelry, for women's pocketbooks, for watches, the whole 9 yards, and no one seemed to have a problem with that. So what are the general policies? Well, certainly if a reviewer or I, when I was still consulting for Medtronic, I did not review any of their submissions. One recuses oneself with that potential conflict of interest. Authors state all industry relationships. There's a self-appointed committee, the International Committee of Medical Journal Editors, who developed an electronic uniform disclosure form. And interestingly, one of the questions on that disclosure form was your religion. Why on earth would you have to disclose your religion? And then I started to think the General Medical Journal, if you're talking about abortions or use of human experimentation, I guess religion might be a potentially important conflict of interest there because of the uproar though they subsequently took that out. An author should describe the role of the study sponsor, if any, in study design, collection analysis, interpretation of data, writing the report, and decision to submit the report for publication. Now, writing the report is an interesting thing. There's a whole hullabaloo today about paying writers to write a scientific report and then you putting your name on it. That's obviously a no-no. Yet for those of us in academia, forever we've had the junior researcher write the report, the drafts, and then we obviously edit it. Is that any different from having a paid scientific writer do it, and then I read it, edit it, and approve it? But the powers that be feel that it is. And then you need to indicate that you have full access to all of the data and that you take complete responsibility for the integrity of the data, accuracy of the data analysis. All that is quite reasonable. But what's the reality? The reality is that academic-industry relationships are an essential component of research, and I should have put in education as well. A year or two ago, when the Medtronic senior executives told me, we can build almost anything to go in or on the human body, but we need you to tell us what you want us to build. So that relationship between us and industry is absolutely vital. And indeed, over half of the academic scientists have industry relationships, most often consulting, research funding, providing scientific advice. And it's most common among the most productive academic scientists. You're not going to want someone who is not knowledgeable in your area to consult for industry, so obviously industry picks the most productive and presumably knowledgeable scientists in a particular area. And every academic institution involved in research most likely has some form of institutional relationship with industry. Well, that's all very well said and good. What are the risk-benefit ratios? Well, the benefits are that these relationships facilitate discovery and advances that improve our care of patients. I think that is the fundamental reason for our interactions. But public studies whose conduct involve financial relationships between academia and industry have been shown to disproportionately support the use, safety, and desirability of the company's products and services, leading to perception that industry sponsorship results in a systematic bias in favor of industry. And that's the problem. If I'm consulting for a company and write about their product, am I biased in what I write? And indeed, that may be true. This is a recent example. You're all familiar with Taser, the gun that the police officers used to subdue an individual. There have been over 400 deaths associated with Taser administration. And interestingly, the recent abstract at the May HRS meeting, subsequently to be published in American Hurricane, studies funded by Taser or written by an author affiliated with Taser were 20 times more likely to conclude Taser is safe compared to studies without such affiliation. The suggestion of bias is very clear, and this is a scientific compilation of over 50 studies related to Taser administration. So disclosure, as I said in my second slide, is the usual response to concerns about academic and industry relationships and is essential. And indeed, academic researchers receiving money from the government for their funding have to report any relationships where they are paid more than $10,000. So, this article, published a couple of months ago, raised a big profile. This was an article about potential conflicts of interest in cardiovascular clinical practice guidelines. Now, the guidelines are absolutely essential today for how we practice medicine, guidelines for ICD implant, pacemakers, and so on. And they analyzed 17 of the most recent ACC-AHA guidelines through 2008 and found that over half of the authors had a conflict of interest. And they concluded that conflicts of interest are prevalent in cardiology guidelines, but there seems to be a significant number of experienced experts without the conflicts of interest. But, Dr. Steve Nissen said, these conflicts undermine the reliability and credibility of the guidelines. I don't think that disclosure is the antidote. The antidote is not to accept money for promoting drugs. Dr. Nissen accepts money for consulting, but he says he donates that money to charity, which I'm sure he does, but is that not a conflict of interest? Dr. Nissen doesn't seem to think so. So my response to Dr. Nissen's statement is rubbish. This is guidelines that I co-chaired, published in 2006 on ICD use or management of patients with ventricular arrhythmias and prevention of sudden cardiac death. I and Dr. John Kim were the co-editors. There were 39 authors, about half without industry ties. The article, finally completed, was sent to at least 20 outside referees with 1,000 critical comments, each of which were answered by Dr. Kim and me, sent out for re-approval by those outside consultants, and subsequently approved by ACC, AHA, ESC, HRS, EHRA, regular alphabet of organizations. I find it hard to believe that my relationship with Medtronic in writing these guidelines had any impact at all on the subsequent outcome. Indeed, other guidelines go through the same rigorous analysis. So I like and respect Steve Nissen very much, but I disagree with him in this application. Well, there was an article in the New England Journal that's taken a lead in this area and published this Disclosing Industry Relationships toward an Improved Federal Research Policy, and they came out with a number of guidelines. Reduced disclosure threshold, not $10,000, but $10 per gift or premium. or $100 per year. So you can't accept a pen, ballpoint pen from industry if it's more than $10, or at least you have to disclose it. They suggested creating standardized federal reporting form, and for the NIH, for the granting institutions should be required to use it. That the NIH should fund research on the nature, extent, and consequences of the failure of faculty members to fully inform their institutions about industry ties, and the research findings should guide further governmental actions. That Department of Health and Human Services should offer guidance to grantee institutions regarding the most problematic types of industry relationships. Interestingly, some years ago, when I had a patent that looked like it might make some money, though it was owned by Medtronic, I made a penny from it. My institution had an uproar. My God, how could you patent something? How could you have a press conference about it? This is 30 years ago. Today, they want you to patent it. They want you to have a press conference because obviously it brings dollars, but it has to be done appropriately. Data on academic industry relationships at investigator and institutional levels should be made available on the web, and that indeed is being done. I don't know about other industries, but I know Medtronic has a website available to the public that lists all of the dollars their investigators receive from Medtronic. And then they suggested additional funding should be provided to offset the additional costs associated with this increase in monitoring. Well, there was a challenge about how accurate physicians are in reporting their conflicts of interest. This was an article published in the New England Journal, and they analyzed reports of payments made to physicians by 5 manufacturers of total hip and knee prostheses, and they found that the rate of disclosure was about 80% for directly related payments and 50% for indirectly related payments. And the reasons most common for non-disclosure, that 20% that didn't disclose when they were presenting an abstract on hip replacement that they received money from the industry. Payment was unrelated to the, please remind me of when you lost your homework and you said the dog ate it. Payment was unrelated to the topic of the presentation at the end of the meeting. Physician misunderstood the disclosure requirements, or payment had been disclosed but was mistakenly omitted from the program. The dog ate it. But nevertheless, 80% did disclose according to this article. Now, the Institute of Medicine, who has taken a very much more vigorous and vibrant role in medicine over the past 10 or 15 years, starting with pointing out all the academic deaths in hospital and how we could eliminate those errors. They weighed into this as well. So they've said very clearly researchers should not conduct research involving human participants if they have a financial interest in the outcome of the research, except if their participation is absolutely essential. And that's reasonable, and I think most institutions now prevent a individual from being a principal investigator of a study if he or she is a consultant for that particular industry. And that's fine. But they also recommended that faculty no longer accept gifts or dinners, no longer accept making presentations controlled by industry, no longer claiming authorship for ghost-written publications. I spoke about that earlier. And not enter into consulting agreements that are not governed by written contracts for expert services to be paid at fair market value. What's fair market value? Is a highly sought-after expert who charges a lot of money. Is that the same as an inexperienced investigator who does not charge as much? So fair market value is kind of hard to establish. Medical centers should also restrict visits by industry salespeople and limit the use of blood samples. And I think most places are in accord with these recommendations. So, the Heart Rhythm Society has weighed into all of this, and I think the article that was first authored by Bruce Lindsay and the group published, as you see there, I think this really sets a very nice framework for how we should interact with industry. And I'll go through their points in my closing slides here, but I highly recommend all of you who are interested in this particular topic to go to this article and go through it, because it represents, I think, a very careful thinking and analysis of the problem by a number of experts. So they start with HRS works with clinicians, scientists, allied professionals, industry, and government agencies to accomplish our mission of healthcare. These stakeholders comprise a coalition of experts that furthers the field of heart rhythm disorders. Industry is an important member of this coalition, and HRS's relationship with industry is critical to the continued growth of the field. I think very importantly, and to HRS's credit, they have recognized the importance of industry. We see so many, the IOM and others, that want to throw the baby out with the bathwater, that, oh my God, any relationship with industry is bad. It's not. It's essential. It needs to be done appropriately with good guidelines, but we need to recognize how important industry is for the development of the advances that we use, pharmacologic, electronic, whatever it is, for the benefit of our patients. Because without this partnership between us and industry, our patients would suffer. So HRS indeed recognizes that in very appropriately. And then they go through the relationships that they consider essential here. Why collaborate with industry? For problem solving, innovation, development of safe and effective drugs and devices, development of guidelines and consensus documents, development of standards for transparency in industry. Then we have a separated governance from industry. So disclosure of personal family relationships for CME. Industry cannot be in a leadership role. President or president-elect, that is, the president of HRS, president-elect of HRS, can no longer have a paid-for consultant relationship with industry. They are allowing a relationship, but you cannot receive any dollars for that. And that applies to the Heart Rhythm editor as well, which is the reason why I gave up my consultancy with Medtronic last December. At the request of Heart Rhythm Society, they have now put in place the establishment that the president-elect, and the editor of Heart Rhythm cannot have a paid-for relationship with industry. They have a paragraph on perspectives on industry funding accepted by Heart Rhythm Society. So there can be no restrictions or guidance on CME expenditures. Industry has to give that money and then basically get out of the way. All disclosure forms are public on the HRS website. HRS maintains control of CME educational programs and scientific and health policy objectives. Disclosure of relationships with industry will be in categories of no dollars, 1 to 10,000, and you can see the different groupings. Research grant awards. HRS is the sole administrator of its research funding programs, expects and encourages dissemination of the results of the research. Industry sponsors may not scrutinize, manage, direct, or control any research projects funded through HRS, and is not entitled to any intellectual property from research funded through HRS. Industry-sponsored research support is disclosed on Heart Rhythm Society's website. CME, separate CME from industry exhibit and programs, adhere to the ACCME guidelines. Preferable is multiple supporters for educational programs so that you don't have the bias of a single supporter. Disclosures, as we talked about, and eliminate biases in presentation. For non-CME content, it has to have general applicability, and non-HRS material must be reviewed and approved. Financial support for HRS initiatives must be approved by leadership, and fellows in training must conform, giving money for fellows in training must conform to these established guidelines. And endorsement or support of international meetings, the program must be independent and disclose financial support. Industry relations and health policy, industry may not participate in performance measures, legislative initiatives, guidelines, reimbursement issues, quality improvement initiatives, but we may work with industry in safety advisories or recalls or promotions for public awareness. Scientific and clinical documents, the scientific guidelines are developed without direct support from industry. Participants disclose any conflicts of interest. Relationships with industry do not necessarily bias opinions or recommendations, when I made earlier. And experts in the field should not be restricted from full participation, provided they recuse themselves when potential conflict of interest arises. Selection priority should be based, that is, for the participants, on expertise, judgment, and writing ability, and at least one of the chairs should be free of any relationships to industry that would apply to the document, and it should be subjected to grounded outside peer review. And then finally, the Publications Committee, that's to whom I report. What? I have more to say. Thank you. Publications Committee and senior staff provide strategic direction. That's to whom Park Ribbon editor reports. Policy oversight and business decision for Park Ribbon, while the editor-in-chief has full editorial responsibility and cannot receive income from commercial entities that pose a potential conflict of interest. And indeed, I do abide by that. So, what do we conclude? Task Force concluded that HRS has sufficient measures in place to prevent undue influence from industry or introduction of industry bias into HRS-sponsored educational programs, research, scientific documents, and policy initiatives. And I agree. I think they've written an excellent document that can serve as an outline for the rest of the relationship. I have one or two more slides. And you got it up there, but I'm losing it over here. All right, so to answer the question, industry relations, where should it start and end? That was the topic I was given. The plain fact is we need industry, and they need us to improve patient care. But remember, Francis Peabody wrote this in 1927. The secret of patient care is caring for the patient. And then when I was president of the college, I wrote, treat each day as your last, and each patient as your first. And finally, wisdom is knowing what to do next. Virtue